When I first joined, my first career was a POL troop, Petroleum Oils and Lubricants. I was a fuels troop as my first job. After that, I went into recruiting for the U.S. Air Force, and then after that, I became an optometry technician. It was when I became an optometry technician that I had a exposure to what physician assistants do, and then gained my interest, did my prerequisites, applied for the program with the Air Force, Inter-Service Physician Assistant Program, IPAP, and I got accepted and then became commissioned as a physician assistant. Joint Base San Antonio actually is where it's located. I had to accomplish my prerequisites, and then I went through a selection program. All that is submitted through San Antonio. Once I was selected, you do 14 months didactic and then 12 months in clinical. So it's approximately a 2.5-year program once you get selected, and they award you your master's degree in physician assistant studies once you're done. Physician assistant in the U.S. Air Force does a lot of things. We have many different specialties. Usually they start off as family practice physician assistants, and we see family practice patients, usually ranging anywhere from 13 to adults, and then on most common things and most common diagnoses. The reason I wanted to become a physician assistant is when I was an optometry technician, I wanted to do more for the patients. I wanted to help them more. I knew that I didn't want to stop patient care and being a technician. I wanted to be the one to give them the care they needed and help them throughout their journey of problem to healing. Absolutely not. Absolutely not. I think my major motivation was my family, my wife and 2 children. They are the main reason why I excelled in the program, because they gave me my motivation. I was hired to be a PA, but I would be willing to do whatever the Air Force needed me to do. It is comforting knowing that I was selected to do a specific job, being a physician assistant, and it does make me feel a little bit better, and also my family is comforted knowing that I'm doing the job that I was hired to do. The ones that I still keep in contact with, of course, there are only a few of them. They've all accelerated in the ranks, in the enlisted ranks. So they're all master sergeants, senior master sergeants. So at the same level of expertise, of course, in a different career field, I respect them very much. In a small way, I owe everything that I have according to the colleagues that I had at that time. They're the ones that shared their experiences with me, as my colleagues do now. And it's that experience that has put me where I am now. I've been in the service for 14 years. I've been a PA for 2 years. I'm a junior PA. Yes, I still have a lot to learn. So I'm learning new stuff every day from my fellow PAs and fellow colleagues as docs or nurse practitioners. We're learning every single day things that we haven't encountered before, and a lot of our strength as providers comes from our colleagues letting us know what they know. We share all the experiences we've had. I've only been stationed here. This is my first duty station, and the exposure that I've had so far is just family practice, but I will soon be going to flight medicine as a PA as well. Of course, at every location there is going to be a senior PA. It just usually means the PA that's been there the longest with the most experience. Now, future career, there are several different programs that you can do while being a physician assistant in the Air Force. One, you can switch over to flight medicine. Also, they also have fellowships, surgical fellowships, emergency medicine fellowships, orthopedic fellowships. All of those require additional training, and are also very selective, but there is great room for expansion and progress if you decide to do so. The biggest thing is, as a medical provider, a junior medical provider, the hardest thing is not knowing what you don't know. You are constantly having to do research, further education in order to make yourself a better medical professional. And I think that goes along with all medical professionals, not just physician assistants, including docs and nurse practitioners, nurses, technicians, everyone that pretty much works in our clinic. We all strive to be better the day after and keep expanding our education.